Hi, everyone. So excited to introduce my guest today, Lilly Martin. Thank you so much for being on today.
My pleasure.
So, Lilly, you are a midwife.
Yes.
And I think there is so much misinformation about midwives out there. So I'm so excited to have you on today. But before we get started, can you tell me a little bit about you and your journey here? Maybe a little bit of personal as well as your journey to midwifery.
Well, I am living up in Creemore, which I lived in Toronto for 15 years, but moved up here about 11 years ago with my kids and I went back to school at 30 actually to when I realized I wanted to become a midwife, because I didn't even know what a midwife was when I went to university the first time around. Hadn't heard of them, but as I've been fascinated by birth since I was a little girl, and pregnancy, and just decided at 30, to apply to Ryerson. So I went to Ryerson University and did their part-time program. It took about 6 years, and I had a baby in the middle, my first son, who's now almost 19.
Wow.
But yeah, I did the midwifery education program through Ryerson University, and have been practicing since 2006.
Wow, that's incredible. Well, congratulations. That's definitely a big feat to accomplish. I mean, going back to school in your 30s, having a baby in there and doing a midwifery program, which isn't that easy in itself. So congratulations. Well done.
Thanks.
Well, I'm glad to have you on because I know working with a lot of our new and expecting parents, we get emails and calls all the time. And I can't believe that even though you guys have been around for so long, some families still don't understand the difference between a midwife and a doctor, or between a midwife and a nurse, or even, a support worker that might be out there. So I think that's the first thing we'd like to share is, tell us what a midwife does from start to finish. What is your task in the role of someone who might be having a baby?
Yeah, well, we field a lot of the same questions. I think that there is a lot of, despite the fact we've been regulated health professions for 26 years now, we're still working on really getting the word out about what we do. Midwives are fully integrated into the healthcare system, and our services are covered by the Ministry of Health. So I like to say that, if you pee on a stick in Ontario, and if you live in Ontario and you find yourself pregnant, what do? You can either go call your family doctor and go to see them for prenatal care. And if they're one of the few family docs who still does deliveries, they might be able to take care of you all the way through your labor and birth. Or they might refer you to an obstetrician or a midwife, because those are the three sort of primary maternity care providers: midwives, registered midwives, family doctors, and obstetrician gynecologists. And we all provide access to the same bundle of maternity care services, or not the same exactly, but essentially you have access to all the same tests, ultrasounds, interventions, medications, anything that you might need during your pregnancy, you can access through midwives or docs. Probably there are quite a few differences between midwives and doctors in terms of, though, our model of care. And significantly, midwives are trained and prepared to do out-of-hospital births. So whether that be in a birth center, if you live in one of the centers where there are birth centers, Ottawa and Toronto being the main ones, you can have access to a birth center, or at home. Or we find up here sometimes in a chalet, or anywhere outside of the hospital that you'd like to deliver. Midwives, as long as you're low risk, healthy, and all is well, we can plan for a home birth or out of hospital birth.
That's amazing. And I think that's so important because what you offer is more options. And I think that's clear. So to be clear cut here, so parents know, if they're hiring a midwife, they would not be needing a doctor or an OB-GYN. You are in the place of.
That's right. In fact, you don't, as long as you're a resident of Ontario, you can access midwifery care. So that is to say, perhaps you're a newcomer, you've just arrived and you don't have OHIP yet. Midwifery care is funded for all residents, regardless of whether they have OHIP or not.
Okay, that's good. Now, do you know, sorry, go ahead.
No, that's okay.
I was going to say, do you know if there's any major differences across Canada for anyone that might be listening from the country? Is each
Yeah, I
province
can't
different?
speak to that so well, Debbie. Sorry.
That's
I'm not
okay.
up to date on that, but
That's okay. That's good to know that in Ontario, though, it's paid by our WOHIP. That's fantastic news because, again, that's another myth that people think they have to pay for a midwife. So that's really good to know, too. So tell me maybe some three, if you can think of three differences, just sort of clear cut differences between you and having a doctor. I know you mentioned one of them.
yeah, well, I like to say that as midwives, because our scope of practice is pregnancy, birth, and the first 6 weeks postpartum with parent and birthing parent and baby. So that's all we do, and we specialize in that. And we're sort of experts. We sometimes say experts in normal birth. When you look at either a family doctor or a OBGYN, their scope of practice is much larger. They cover the things that they do. They do a lot more different things and take care of people in a lot of different ways. And so what it affords us as midwives, since our scope is so specific, it affords us the luxury of time with people. And so we can have longer prenatal visits. We do home visits, sometimes prenatally if you're thinking about a home birth. But certainly in the postpartum, we usually do about at least four home visits to check on breastfeeding and how baby's doing and how the parent's doing as well. And so we have, a lot more time. We have a lot of expertise in breastfeeding support. That's a big one if people are planning to breastfeed or chest feed. The other, in terms of the other differences, I guess there's quite a few. Your midwifery team is available to you sort of 24 hours a day, 7 days a week by pager. So that's for urgent concerns. But obviously the one that most of us think of is, I think I'm in labor. You can reach your midwifery team directly. And I think that, and also if you just have, something happens and you're worried during your pregnancy, whether you use the pager or whether you call the office, we have a system where we can reach out and answer questions and address concerns very quickly with someone that you know. And we talk about midwifery care. Our philosophy has sort of three main tenets. I've referred to one of them already, which is choice of birthplace. But the other ones, I would say the central one, in fact, is informed choice. So we lay out your choices. We lay out, we give you the information about the risks and the benefits of any given either test or intervention or any kind of choice you might have to make while you're pregnant. And then we respect you as the central decision maker and support you to support your choice, basically. And that's a very empowering, I think, way to work with a care provider when you're pregnant, because it does prepare you for parenting in a sense, because once you have your baby, you're in charge, and you're going to have to make it's literally like the choices that you make when you're pregnant. That's just the beginning of that parenting journey. And so I think informed choice really is a strong foundation and a good approach to the journey of becoming a parent. And then the third tenet of our philosophy is continuity of care, which means getting to know your midwives, having a small team of midwives that you meet with antenatally in pregnancy. And so that when you do make that call, either in labor or with another concern, you usually know the other person on the other end of the phone. And that makes a real difference. Knowing that your team knowing you and you knowing them, you develop a relationship of trust and comfort, and it just makes the whole experience, I think, it reduces stress, it reduces anxiety, and the whole process of birth in particular unfolds much better when the person is feeling safe and comfortable and supported.
I love that. You've touched on so many great topics that I think a lot of people don't know. I mean, one, the continuity of care. It's so important because I think many of us, I for one, I did have an OB-GYN that was with me for my pregnancies, and I fell in love with my doctor and I was so excited. And then I went to give birth and she wasn't there. It was someone else that I've never met before. So, you know, if there's a couple of people on your team that, you know, one of them are going to be there, that's an incredible, you know, feeling to be able to be with somebody who knows you personally. And then, you know, you talked about another big one, which is that you are sort of an expert in this prenatal birth and postpartum field. Whereas I think sometimes when we're going to doctors, they know everything about pregnancy and childbirth and even the physiological recovery of mom afterwards, but they may not necessarily know about breastfeeding, whereas you guys can help with that, you know, immediate postpartum or even those home visits. So those are all incredible things. And then the last one is choices. I think that we all don't have enough choices anymore. A lot of us, especially this last year, it feels like we've been taken, all our choices have been taken away. So I want to chat a little bit about home births, because if someone does decide, I'd love to have a birth at home, maybe you can share a little bit about what does that look like? What sort of things maybe they think about or consider if that's something that they're looking to do?
Okay, well, yeah, I mean, like I said, if the pregnancy is going along normally and we don't anticipate, we don't have any reason to expect a complication, because then we can plan for home birth. We talk, you know, there's all the things that you need for the home birth, like in terms of equipment and supplies and things we bring. At our practice, we send folks home with a big box of supplies that we're going to need and ask them to keep it at home. So that reduces the number of things that your midwife needs to kind of haul into the house when she arrives when you're in labor. And we also often do a prenatal home visit. So we come over and do one of your prenatal visits at home. And that's an opportunity to talk about how we manage you know, the equipment that we bring, how we would manage any emergencies if they occur, reasons we might recommend transporting into the hospital. So, you know, making a change, because a lot of, when we plan for a home birth, we stay there as long as things remain normal. And if any complications arise, then we recommend moving into the hospital. So we talk about, you know, what those things might be so people feel prepared. There's not a lot that the family has to do to prepare for a home birth. I mean, we need sort of a space to set up our equipment, a little area for resuscitation of the newborn, in case that's needed. Some people want to plan for a water birth, or at least to labor in water. And in those cases, for example, at our practice, we lend birth pools that are inflatable, and they come with where you have to purchase a disposable liner for it, but it's inexpensive, and it provides the opportunity to labor or give birth in the water.
Amazing.
Yeah.
Amazing. That's great. I'm curious too, when it comes to hospital birth, is there anything different in a hospital birth with a midwife versus a hospital birth with a doctor?
I think the main well, there's probably a few things that are different, but probably the first that I'd point out is that the doctors aren't there continuously through the labor all the way through till sort of 2 hours, minimum of 2 hours postpartum. Nurses, the doctor and the nurse work in tandem, with the nurses providing the labor support and monitoring of the labor. And, you know, if they have a concern, they can call the doctor back, but then in the normal birth, the doc would be called back for delivery, and would stay, you know, until the placenta is delivered. And if any suturing is needed, they would do that. And you know, but if mom's stable, then they would leave again, because of course, as I pointed out, they're busy and they do a lot of other things. And the nurses would provide the postpartum care. Whereas in midwifery care, we are with the person when they're in active labor, continuously all the way through till usually 2 to 3 hours postpartum, if all is well. Amazing. And so that part of that, I guess, that continuity that we talk about. So we sort of do the nurse and the doctor role combined. It's in hospital births.
Amazing. That's incredible. I want to debunk another myth here, but if someone does choose to go with a midwife, can they still have the epidural?
Absolutely. Yeah. If that's your plan, we are there to support you. And I always talk to people in advance about it. You know, I'll say, are you planning on an epidural? Let me know, because I don't want to spend any time trying to support you out of it, right? Because other people come to us and they really want to avoid pain medication if they can, in which case we're really well positioned to help people try to do that. But no, we can, I mean, it varies across the province, but in most cases, and certainly in my practice, we can consult directly with anesthesia and get you an epidural if there's time.
Yeah, that's good to know, because I think that's a lot of, a lot of pieces when parents are going through midwife versus doctor, they're starting to rationale some of these things that actually aren't true. So that's an important one. What about another one in terms of bottle versus a breastfed baby? Would that hinder if you would support a family?
Absolutely not, because our central philosophy is informed choice. So we provide information and then we support people's choices. I like to refer, I mean, when you're in midwifery care, you're not losing out, you're not missing out or foregoing anything. You can access everything that any other person would access if they were with an obstetrician or with a family doctor. We just provide more time and skills and support in the realm of pregnancy, birth, and the first 6 weeks postpartum.
I love that. So this is a win-win, because they're getting way more for the same. It's not taking any more out of their pocket or any of that. So
yeah, it is a wonderful model of care. I feel very fortunate to be able to practice in this model. It is a bit of a privilege to have the time to be able to focus on this particular time in people's lives.
Absolutely. Is there anything that parents should consider if they are debating whether to go with an OB-GYN or a doctor or midwife? Is there any top things that you might tell them, consider this before making a decision?
Well, I mean, if you can access midwifery care, I would recommend that you start there if you're a healthy person without any significant, underlying medical conditions. But you can always call a midwifery practice or email them, do their online intake form. And then we all provide a 30-minute-ish kind of information session where you can have a conversation with the midwife and decide after that whether it's right for you or not. If at any point in your pregnancy you need, like something arises where that is outside of our scope of practice, that you need a doctor, for example, we consult directly with the obstetrical team in your community. So not to worry if you start out in midwifery care, but something comes up, we can access other experts to come in and be part of the team. And in lots of cases, you can remain in midwifery care even if a complication arises. Your midwives can provide something we call supportive care in those cases. And sometimes after the birth, then you come back into midwifery care, and then we can do that postpartum support. So I would say, good. I mean, honestly, I know I'm a bit biased, but I would say start out trying to access midwifery care, and then take it from there. The thing is, though, that we're training midwives as quickly as we can, but and there are over 1,000 now in the province of Ontario, but a lot of practices have waiting lists, because the last stat I heard was up to 40% of people who try to access midwifery care unfortunately can't, because there are not enough spaces. We take a limited number of people because the care we provide is so intensive. As you can imagine, we can't have unlimited numbers of people delivering in a given month. So yeah.
That's great. So to touch on that topic, what would be a reasonable time in your pregnancy to reach out to midwifery care? I mean, I imagine 2 weeks might be too early, but at what point would you say is a good time to reach out where there's still likeliness that they can take you?
Well, ideally, as soon as you find out you're pregnant, which can be 2 weeks pregnant is kind of conception. It's a weird thing, the way we calculate gestational age. So literally as soon as you know you're pregnant. But I have to say too, if you're hearing this and you're 5 months pregnant or something like that, don't be discouraged. You still reach out, because things change, and some practices even save spots for what we call late to care folks. Especially in the urban center in Toronto, for example, there can be people who are arriving in the country pregnant and don't have OHIP. And of course, as I mentioned, because we can provide care to those people, we're funded to, a lot of practices will save a spot for them, spots in their month for people who for a number of reasons might not be calling until later in the pregnancy. So ideally at the very beginning, but if you're midway through, please don't be discouraged, still try.
That's good. That's good. Well, one of the things that I think about in terms of my pre-pregnancy or pregnancy is, you know, I wish I knew, and I wish I knew what midwives truly were all about, because 20, 22 years ago, we certainly didn't utilize them the way we do now. So my I wish was, I wish I knew then about midwifery care, how I know it now. So I'm going to ask you that question and put you on the hot seat. But tell everyone sort of what was your I wish I knew then moment. What was something you wish you knew then about pregnancy or childbirth or parenting that you know now?
Well, you know what? I guess I wish I knew that you don't have to do it right. In fact, there is no right way to do it. And I think in particular nowadays, there's a lot of pressure on parents to get it right, to have the right kind of birth, to raise their baby in the right kind of way, to have the right equipment or gadgets or whatnot. And, you know, we are mammals, and we give birth. Like, this process of giving birth and parenting is ancient. It's evolved over millennia, and it works really well all by itself. So I think if I could have just been more laid back personally as a parent and giving birth to my own 2 children, that would have helped. I mean, but we do the best we can, right? So hindsight is 2020. But I also didn't realize how long parenting is. Like, my kids are teenagers now, and I'm like, this is going to go on forever. I know they tell you that when you start out as a parent, but it's an incredible journey. And but I get more laid back about it the longer I do it. And
that's great advice. I think that's great advice, because I think we are becoming so uptight in the trying to do it perfect, when really the perfect is whatever works for your family. So thank you so much for sharing that. Lilly, I want to thank you personally, not just for being on today, but, you know, I know you guys had a crazy last 18 months with this pandemic this year, and you guys have been, you know, on the front line. So I want to send a huge heartfelt thank you for everything you guys have done on your end. We know that you've been struggling as well. And I know that a lot of new and expecting parents are so thankful for all the work that you do. So thank you so much for that. Thank you for being on today. And before we wrap up, where can everyone find you?
Me personally, like our practice?
Your practice.
We are up in Collingwood, Midwives Nottawasaga. And our catchment area goes from Thornbury. We share Thornbury with another practice, all the way down to kind of Shelburne, all the way up, touches a little bit on Barrie, but there's a practice in Barrie, over, you know, to the Wasaga Beach area. So it's actually a beautiful part of Ontario to work in. That's where we are. Amazing. And we're at midwivesnottawasaga.org.
Yes, and we know that's not easy to spell, so I'll make sure that we put that in our show notes as well for everyone. Thank you so much, Lilly. Thank you so much, everyone, for listening and watching, and we will catch you all soon. Thanks, everyone.
Okay, bye.
Bye.